weight. Extensive assistance. The resident is involved in the activity and staff assistance is required to lift, partially lift, and or support the weight of the resident's limb or body, meaning weight-bearing support. You place their hand on the side rail, rolling or holding the resident on their side, lifting their feet on or off the bed, assisting with sitting up in bed, pulling the resident up in bed with them helping. So when you are actually providing extensive assistance, such as guiding their hand to the rail, well, placing their hand on the rail, your hand is on the bottom, you are actually lifting the arm and moving it to that rail. Total dependent. The resident does not help, therefore full staff is required each time. Someone pulling a resident up in bed that does not help and requires 2 staff members to pull would be total dependent. Eating. How a patient eats or drinks. Coding under eating is independent, no hands-on assistance at any time, no cueing. The resident does it entirely on their own. You simply place the tray in front of them and they take care of it from there. Supervision, oversight, encouragement, and cueing. You are reminding the resident what they are doing step by step. Limited assistance. You're cutting up the food, handing the resident the utensils or cup, and or guiding their hands to their mouth. Extensive assistance. The resident participates in eating or drinking, but the staff feeds some bites and assists the resident in finishing the meal and fluids. Dependent. The staff feeds the resident the complete meal. Transfers. How a resident moves from surface to surface. Examples: to and from the bed, to and from the chair or wheelchair, to and from a standing position. This does not include to and from the bath, toilet, shower chair, or bedside commode. That is covered under bathing and toileting. Coding a resident under transfers. Independent, the resident does it entirely on their own. Now, with any of these charting topics, for independent or supervision, you will also see whether it is with setup or without setup. With setup means you have placed the walker or wheelchair next to the resident for them to reach and do the transfer. Without setup means the resident is actually pulling the walker or wheelchair to themselves and doing it completely on their own without any assistance at all. Supervision means oversight, encouragement, or cueing. No touching of the resident. Here again with supervision, with setup, if you pull the walker or wheelchair to the resident and then they do it as you remind them, that is with setup. Without setup, you tell the resident it is time to transfer or get up, and they pull the walker or wheelchair to themselves and they do it. Limited assistance. Bringing the chair or walker to the bed and guiding the hand to the walker or chair, but no weight-bearing support. Extensive assistance. Weight-bearing support is needed. The resident does participate in the transfer, such as a pivot transfer. You're putting their hand on the wheelchair or walker or railing, or you use the Sarah lift or sit-to-stand lift or stand lift, whichever you're used to calling it. We refer to it as Sarah lift in our facility. When using the Sarah lift, it is a mechanical transfer device and does require 2 staff members at all times when using it. The resident is also required to assist when using the Sarah lift. Dependent. The resident does not participate in the transfer. You use your muscles or the Hoyer lift to get them up. Toileting. How a resident uses the toilet room, commode, bedpan, urinal, how they transfer on and off the toilet, bedpan, or urinal, keep in mind, when you are doing rounds and you're checking and changing your resident, that is toileting. Includes how they clean themselves after toileting and changing their pad or brief, how they do their ostomy or catheter care, how they adjust their clothes, but does not include emptying their bedpan, urinal, bedside commode, catheter, or ostomy bag. That is considered part of output. Coding a resident under toileting. Independent is no hands-on assistance at any time. The resident does it entirely on their own. Supervision, oversight, encouragement, or cueing the resident to toilet, wash their hands, or to readjust their clothes. You are still not touching the resident. Limited assistance. Assist with zipping and buttoning, handing them a washcloth, but no weight-bearing assistance. Extensive assistance. Weight-bearing support is needed. Assist them on and off the toilet, bedpan, bedside commode. You're assisting them with changing their incontinent products and their paracare, and any weight-bearing assistance. Now, if a resident has started out independent, they've taken themselves into the bathroom on their own, they've pulled down the pants, they are going to the bathroom, and then they pull on their call light for assistance, and then you must come in and provide paracare. The moment you take that wipe or washcloth and provide that paracare, you are then using extensive assistance. For dependent, the staff does all the work, the resident does not participate at all in assisting. Bath. How the resident how we assist physically while transferring, and how we assist in helping them bathe themselves. Always code the most care you assist with. If a resident refuses the bath, you must notify the nurse as soon as possible. Coding a resident under bath. Independent is not something we do for safety reasons, so all bathing must be at least supervision. Supervision, meaning oversight, encouragement, or cueing. Limited assistance. Assist the resident with zipping or buttoning, handing them the washcloth, but no weight-bearing assistance. Extensive assistance. Weight-bearing support is needed. You assist them on and off the shower chair, assist with undressing and redressing, provide paracare and any scrubbing, any other weight-bearing assistance. Dependent, the staff does all the care, the resident does not participate in providing their shower. Personal hygiene. How we care for the resident's personal grooming of their body. Examples, how we or they brush their hair, shave or clip their nails, put deodorant on and wash their face, and brush their teeth. Coding a resident under hygiene. Independent is no hands-on assistance at any time, no cueing. The resident does it entirely on their own. Supervision. Oversight, encouragement, or cueing, but no hands-on assistance to help the resident do it. Limited assist. Putting paste on the toothbrush, turning on the razor, and handing them the device for them to do it, but they do it themselves. Extensive assistance. The resident participates in any grooming, and then the staff finishes it up, including if the staff shaves the resident. Dependent, staff does all grooming care, hair, nails, teeth, dentures, deodorant, etc. Walking. There are two categories for walking. Walking in room, the definition is how the resident walks in the room to and from their bed to the bathroom or anywhere in their room. Walking in hall, how the resident walks in the hall to and from. The definition for both walking in the hall and or the coding for both walking in the hall and walking in the room are independent, meaning no hands-on assistance at any time. The resident does it entirely on their own. Supervision, oversight, encouragement, and cueing. If a resident has a wander guard, they should always be supervision, if not limited or extensive. Limited assistance, holding hands but no weight-bearing support. Extensive assist, any weight-bearing assistance, holding the hands or holding a gait belt where you are actually assisting support the resident's weight. Moving on unit. The definition for moving on unit is how a resident gets to and from a place on the unit and how much help is needed. The coding for moving on the unit is the same as that as moving off the unit. So I will go to the moving off the unit definition. Moving off the unit, how a resident gets from the unit to other places throughout the building. Examples, the dining room, beauty shop, activities, and therapy. Coding for moving on and off the unit include independent, meaning no hands-on assistance at any time, no cueing, the resident does the ADL entirely on their own. Supervision, just oversight, encouragement, or cueing. Limited assistance, holding hands, no weight-bearing support. Extensive assistance, any weight-bearing assistance, holding their hands, holding the gait belt, or guiding them through the halls and helping them. If they're in a wheelchair and they are able to roll part of the way, but then you must guide them around obstacles, that is extensive assistance. Dependent, you are doing all the work, pushing them around, and they are totally dependent on you for locomotion to get from one place to another. Dressing. Definition, how the staff assists with dressing the resident. Examples, shirt, pants, undergarments, Ted hose, socks, and shoes. Coding a resident's ability to dress. Independent, no hands-on assistance anytime, no cueing, the resident does it entirely on their own. Therefore, they walk out of the room fully dressed, you did not need to provide any assistance. Supervision, you are getting the residents' clothes out and watching them dress, oversight, encouragement, and cueing them what to do. Limited assistance, helping guiding clothes over their head, buttoning or zipping. No weight bearing or lifting of the limb to help put in an arm or leg. Extensive assistance, if the resident can dress any half of their body but still requires some help lifting of any limb. Examples, assisting putting on Ted hose, socks, shoes, lifting an arm to put in a sleeve, holding a leg to put on pants, that is extensive assistance. Dependent, staff does all dressing and the resident does not assist at all. When assisting a resident with a bra, if you are simply hooking the hooks in the back, that is limited assistance. But if you have to actually assist with lifting the breast into the bra, that is extensive assistance. Shortcut on coding ADLs. Independent. The resident does it entirely on their own. There's no help with staff oversight at any time. Supervision. Oversight, encouragement, or cueing. The staff uses their eyes, mouth, but no hands. Limited assistance. The resident is highly involved in the activity and staff provides physical help in guided maneuvering of the limb or other body part, but no weight-bearing assistance. A guiding hand is on top. Extensive assistance. The resident is involved in the activity, but staff provides weight-bearing support. Staff uses hands and bearing some or any of the resident's weight. A lifting hand is on bottom. Total dependent, full staff performance during care. Staff performs the entire task. The resident does not do anything to help. The next section is non-ADL charting topics. This will cover the non-ADL charting topics, definitions of the non-ADL topics, and the importance of each non-ADL topic. The first three are part of the output charting. The first one is voiding output. The definition, urine output both continent or incontinent. Keep in mind, when you do a check and change, chart whether a resident has voided or not for each time. Also chart what incontinent products you used to provide them when they do void. Examples, when you go to do a round and your resident is dry, you would chart that as a no void. You go to do a round on the resident and they are soaked, you would chart that as an incontinent void. You go to take the resident to the toilet and they tell you they are okay, that will be charted as a no void. You go to take the resident to the bathroom and they are soaked, that will be charted as an incontinent void. You go to take the resident to the bathroom and they are dry and then they urinate, that will be charted as a continent void. The second part of the output charting is urine output for the measured urine. This will be used for measuring urine output from a catheter or to track a resident's urine output when we use those hats in the toilet. Third part of the output charting is stool output. The definition, when a resident has a bowel movement, how much they went, how many times they went, and whether they were continent or incontinent. Please make sure you chart this very accurately. We do not want to give our residents stool softeners if they are not needed. Also, a smear on a brief is not considered a stool. 4-day voiding record. This is where you will chart people that are on a bowel and bladder assessment. This is not only used for all new admissions, but even for our long-term residents as well when we see changes in them. This is very important to code accurately and in a timely fashion. Scheduled toileting. This is what the resident may be placed on after following through with the bowel and bladder assessment. This button is used for charting a resident's output when our resident is placed on a toileting program that is scheduled to meet their needs. Please code and chart this accurately and in a timely fashion. This is one of the reasons why it is important to chart at least every 2 hours. Intake. This button is for additional fluids we give our residents in the course of our shift other than what they get served at mealtime or snacks. Accurate charting of this can help determine whether a resident has or has not had adequate fluid intake. This also does not include fluids given during med pass. Behavior. This is where you can chart the residents' behaviors when they might act out. This is also how you may how many times they may act out and how you may have diffused the situation. This is very helpful in seeing how new medicines are working and to see when the residents might need some adjustment in their medicine. It also can show us if there is a decline in their mental status. Please try to chart this later in your shift so you can see how the resident's behavior is throughout the entire shift. However, if you do notice a behavior, please chart it right away, because the number of times you chart a behavior will help indicate the number of times that behavior may be occurring, because that behavior may occur more than once in a shift. Mood. This is where you can communicate how the resident is feeling. You are the person who will know the resident best and can see changes in their mood. You're also the person who might know how to make it better in resolving the problem. That is why it's important for you to document this accurately. This is also where you will document if the resident has a poor appetite. The social workers will use your chart